Hello everyone. So today we will talk about hemodialysis. So hemodialysis is defined as a process of cleaning the blood of accumulated waste products. It is used for patients with end-stage renal failure or for acutely ill patients who require short-term dialysis. So for dialysis procedure we need the patient's access, that is either AV fistula or tunneled or non-tunneled temporary catheter. Once we have the patient access and it is prepared, then we do cannulation. After cannulation, heparin is added if there is no contraindication to heparin. Then this heparinized blood goes through the tubing and pass through a dialyzer. So what is a dialyzer? Dialyzer is actually a semi-permeable membrane across which, through the principle of diffusion, the waste products from the blood enter into the dialysate. So what is dialysate? Dialysate is the treated water from the RO system which has sodium, potassium, chloride and glucose. So across this membrane, through the diffusion, nitrogenous waste are added to the dialysate which wash away these, and this filtered blood came back and entered the human circulation. So this process is known as hemodialysis. Now, what are the indications of hemodialysis when we perform hemodialysis? So if a patient is having acute kidney injury, he would need hemodialysis. If he is having hyperkalemia, which is resistant to the conservative treatment, or if the patient hyperkalemia is severe and having ECG changes, so it is an indication for hemodialysis. If acute kidney injury is due to certain drugs or alcohol intoxication, salicylate poisoning, ethylene glycol, all these are indications for hemodialysis. If a patient is having acute kidney injury and he is in volume overload status, so he would also need hemodialysis. Or if uremia is so much that it is causing pericarditis or uremic encephalopathy in an acute kidney injury patient, so these are the indications of hemodialysis or severe metabolic acidosis. And if the patient is having chronic kidney disease, so the indications for hemodialysis in such patients would be absolute indications are uremic pericarditis, pleuritis, uremic encephalopathy, or some other common indications like declining nutritional status, persistent or difficult to treat volume overload status, fatigue and malaise, also mild cognitive impairment, refractory acidosis, hyperkalemia, hyperphosphatemia. So all these are indications of hemodialysis in a chronic kidney disease patient. Thank you.